Before we get started, I have a quick favor. I've been self-funding the Finding Genius podcast for 5 years now. I've done over 3,000 episodes. And as you can see on YouTube, we're up over 1 million views on the channel, which is fantastic. The next thing I really want to push on is to get up to 10,000 subscribers. Because once we do, we'll be able to put a donate button and we'll be able to solicit donations to help keep the podcast running and to also get the Finding Genius Foundation moving along. We have a big project studying anxiety, depression, and PTSD and working on a product to help people overcome these problems because I've seen them explode recently after the last 2 years of the whole virus situation. So if you would, please subscribe to the podcast. That would help us tremendously. Give us a thumbs up and check in the description for Buy Me a Coffee. It's about $5. If you could buy me a coffee, I'd really appreciate it. It would help keep the channel going, and I love coffee. Thank you.
Forget frequently asked questions.
Common sense, common knowledge, or Google.
How about advice from a real genius? 95% of people in any profession are good enough to be qualified and licensed. 5%
Go above and beyond.
they become very good at what they do, but only
0.1%.
are real geniuses. Richard Jacobs has made it his life's mission to find them for you. He hunts down and interviews geniuses in every field: sleep science, cancer, stem cells, ketogenic diets, and more. Here come the geniuses. This is the Finding Genius Podcast.
With Richard Jacobs.
Hello, this is Richard Jacobs with the Finding Genius podcast. My guest today is Dr. Joel Pash, or Pash. He's a leading expert in penile enlargement and the co-founder of a company called Upsize. They have a national series of clinics dedicated to safe and effective enhancement procedures. It's going to be a very interesting and unusual call. So welcome, Joel. Thanks for coming.
Thank you for having me.
Yeah, how did you get into this area of science and medicine? It's like an unusual area.
Yeah, it is unusual. When I was in medical school, if you would have told me I'd be doing this 20 years later, I obviously wouldn't have believed you. I am an anesthesiologist by training. I finished my residency in 2011. I did a fellowship at Stanford University, and part of that fellowship was practice management, where they, at the time, recruited ex-business people to do that fellowship. And so I'd had an experience in business being a management consultant before my medical career. Anyways, I am an anesthesiologist by training. I've been doing that for years. A couple of years ago, I guess 3-4 years ago now, I decided I wanted to, do something else in medicine, did some research on some options, and actually a marketing guy that I met introduced me to this field. So I had my wife look into it because I didn't want to look at penises necessarily. And it turns out between the two of us, we found out it was actually a real thing that actually worked. That combined with my business experience and the fellowship that I had done kind of put me in a unique situation to be able to not only do the procedure, but then eventually open a franchise of multiple.
Okay. I would think it may be incredibly easy to market it, but then again, I would guess online and a lot of venues, it'd be incredibly difficult to market it because a lot of, I guess there's, my guess, just being a regular person is like there'd be a huge stigma against this stuff, against advertising it. So, like, what do you experience? Is it both easy and difficult to market your products?
Yeah, so that's a good question. I actually, in addition to owning the company, am our main marketer. I do all our Google ads, and to the extent there's any social media, I do that. But we have a fairly extensive Google ads account, and so I'm quite familiar with that. We think that it sells itself, right? Because everyone could send them insure whatever. But as you probably know, there's all kinds of restrictions of actually what you can advertise, both from a regulatory perspective and from what Google Ads or Facebook or whatever allow you to advertise. In fact, probably some of this discussion Google might not be happy with just because of content.
Is this driven by, men that say, oh, I want this? Or is this driven by women saying, hey, I want this for my partner? If it's a guy, like who are the people that come to you and what are the reasons they come to you if it's not obvious?
Yeah, there's quite a few reasons. So I would say the most common reason is just guys that they just want to have fun. They don't have an issue with what they currently have, but maybe they're in that point in their life where having a little bit more useful to them. So a lot of guys are married with, and them and their wife will talk about, hey, what do you think about getting this done? Or maybe the wife had breast implants or butt implants, or in other scenarios, it could be people that have some insecurity, or that found certain cultures kind of unofficially kind of value this more than us, if that makes sense.
Okay, interesting. After the procedure happens, and if it's successful and all that, like, I don't know, what, I guess discreetly, like, what kind of feedback do you get? Does it actually cause trouble sometimes? Does it always help? What feedback do you get from couples?
Yeah, so it's almost always successful. I can't actually think of a time where it hasn't been. Sometimes you could have some like imperfections or cosmetic things that just need like a little bit of product, but it's pretty much always successful. And I would say the satisfaction rate approaches 100%. It's like, not for sure 95%. And actually, I was having a look at some of the studies that were given that I was going to be on this podcast, and that's pretty uniform across the board, especially for fillers. The rate of satisfaction is not nearly as high for most surgeries, but for fillers, it is quite high, probably because it's a fairly low invasive procedure. It's done quickly, and it's pretty low risk, so people don't really see any significant incidents of complications.
So how does the procedure work, if you can say? Like, what happens? Does it increase the girth, or does it increase the length, or both? Like, how does this work?
Yeah, so if you think about you kind of think about the penis as a cylinder, right? So we're adding filler in it. So it's as if you were kind of think about it as if you're putting Play-Doh around a cylinder, okay? Like the Play-Doh or the play. So you can increase the thickness by putting material around the penis. Pretty much impossible to increase the length. Giving the example of putting clay around the penis, you can visualize that you could actually pretty much get it as thick as you want. And the only limitation would really be aesthetics, like, it would not look right, but there's not really thick. Some people report a little bit of length and increase, and that's mostly because the penis naturally shrinks and expands all the time. And so if you have enough material surrounding the penis, then it can actually make it more difficult for the penis to shrink. So a patient would feel like it's actually gained, but in fact it's shrinking.
I guess see possibly a couple of issues. So once you put this material around, what if the shearing force that comes from thrusting would shear off the material and move it down the length of it from its original placement? Can that happen?
Certainly filler can break off and migrate. It's not common. Usually what we see is like filler eventually gets integrated into the tissue. The tissue kind of grows around it. So ideally within couple weeks to a couple months of doing the procedure, it's kind of in a certain way parted, and it's unlikely to break off. So if some filler does break off, it would usually be pretty close to the time that we did the procedure. And the nice thing about hyaluronic acid fillers, which is the ones we use, is that they're dissolvable. So if you do get a piece that breaks off, it's dissolvable. And as far as like actual shearing force, we don't find that happens internally, but that does happen with some of the surgical methods, which are actually, solid pieces of material that are placed in there. It goes in as a gel. So as it hardens, by the time it's hardened, it's actually into.
So is the protocol where you tell the person to abstain from intercourse for like a week or two, or is that necessary?
Yeah, we tell them to abstain from intercourse for 1 week. The main reason is actually not due to concern of migration, because really, like, within 3 days, the filler pretty solid at least. But the reason we ask them to abstain from intercourse is just to avoid traumatizing any infection points. And then, if you have an open sore, you have a possible infection. It's done with needles and then cannula that are like the same size as what you would get a vaccine with. So it's a few very tiny holes. So it's unlikely that those would break open, but we just like to be safe, make sure that, no trauma happens.
Yeah. Is there a trade-off, like a reduction of sensitivity in certain parts?
Typically not. When we inject the shaft, like I said, it's just anywhere from 3 to 6 small holes. The nerve endings are in the skin itself, and we're going underneath the skin. So it's pretty unlikely you would lose any sensitivity. If you inject in the head, which I don't commonly do, but I occasionally do, there is a chance of causing a decrease in sensitivity. And in fact, there's some studies that have been done using injections into the glands, which is the head, as a treatment for premature ejaculation. Because the glands is just a bunch of nerve endings, and when you inject into it, could, cause some decent.
Okay. Can someone be, do they have to be circumcised or uncircumcised, or it doesn't matter?
We can do it either way. It definitely makes it easier if they're circumcised. The reason being that having foreskin makes that skin on the penis like a lot more mobile. And when stuff is mobile, it's obviously more difficult to get like a perfect cosmetic result just because things are around all the time. Having said that, it's totally doable. And I would say 30% of our patients are not circumcised. I should say that there are different techniques for doing this procedure or similar procedures, and certain ways to do it would require you to be circumcised, and certain techniques like the one not.
Before we continue, I've been personally funding the Finding Genius podcast for 4.5 years now, which has led to 2,700 plus interviews of clinicians, researchers, scientists, CEOs, and other amazing people who are working to advance science and improve our lives and our world. Even though this podcast gets 100,000 plus downloads a month, we need your help to reach hundreds of thousands more worldwide. Please visit findinggeniuspodcast.com and click on Support Us. We have 3 levels of membership from $10 to $49 a month, including perks such as the ability to see ahead in our interview calendar and ask questions of upcoming guests, transcripts of podcasts you're interested in, the ability to request specific topics or guests, and more. Visit findinggeniuspodcast.com and click Support Us today. Now back to the show.
What about the distribution? Do you strive for a uniform distribution, or because of let's say the G-spot, you'd have more material on the top part of the shaft versus the bottom or the sides? Does it matter?
Yeah, like most guys want it uniform. Oftentimes we'll try to avoid the top of the penis actually, because there's a dorsal penile nerve there and artery. We don't like to put the cannula or the needle near that, right, because of damaging that. And what we find actually is that if you inject more on the sides than the top, that the actual appearance looks like it's bigger, right? Because if you think about it, if you're looking at the penis head on, if it's wider, it's going to be more obvious, like in the other direction. But at the same time, you get, no matter where you put the filler, circumference and
okay. So
right.
So there's no special
circle, the circumference name.
I see. Again, cosmetics aside, would there be any point in putting filler in such a way that it creates a bump? So when there's a thrusting action, it goes bump, bump, bump across one of the, on one of the surfaces. Like, I know this would be crazy, but do you ever make a ribbed one deliberately? Is that possible?
I would certainly possible. I've never had anyone ask me for it, but it sounds like you might know, there is a thing where people will put like other foreign bodies in their penis. Like a lot of times, like beads is a thing. And presumably it's for that kind of stimulation. I haven't had anyone ask me to do something like that with filler, and you could imagine most of the time people are concerned about is it going to look natural versus like, can you make it look like it's got a bunch of bumps on it? But yeah, certainly it is something you could do. It's filler, so it's going to stay where you put it. So if you want to make a bunch of bumps, you want to do a big line of filler, you can do.
What if someone wanted to write their like their wife's name on it, but it's filler?
You could do it. Sure. I mean, that would be like artistry on my part, but I'm pretty sure I could do it.
Yeah, that'd be hilarious. But it's kind of funny that people, what's the reason they're doing it? The reason, I guess, is, increase the pleasure of the experience, but yet they're also worried about the cosmetic aspect of it. Do you think the cosmetic worry comes from the man or from the partner? I mean, sorry, from the person that's getting the procedure, the guy versus the guy's partner?
Well, like I said at the beginning, it's not always to do with the partner having more pleasure. Like some percentage of guys have some sort of dysmorphia thing where they are not, essentially that's a fancy way of saying they're not happy with the size of their penis despite their penis being normal, right? Like Most guys' penises are normal by definition, but right, like everyone's near average. But
Actually, yeah, what's the variation that you've seen or in literature? Like what's in terms of length or girth variation? Like what does the science say, or what are your, I'm sure you've had many observations. What does that tell you? What does it show you? What's the range?
well, there's obviously a huge range, right? Like there's micropenis, which is an actual medical issue where the penis doesn't develop properly due to lack of hormones, like during and after puberty. So you have that, but notwithstanding that, you have people that just have small penises and people that have huge penises. And then, like I said, by definition, most people are average. What I do see, though, on this note is that thinking that your penis is small has nothing to do with the actual size. So if you have a dysmorphia issue, you could have a penis that's 7 inches long and you think that you have a medical issue because it's too small, or you could have one that's 3 inches long, you think the same. So in other words, there's no correlation between what some of the people actually have and what they feel like they have. I would say if you're asking about average numbers, I think it's the average circumference is somewhere around 4 inches and average length is somewhere around 5 inches. And that's flaccid. So everything on erect. And most people we see are right around that.
Oh, but what about when erect? What are what's the girth and size distribution that you've seen, like the ranges?
The girth would usually increases by about an inch and then the length about 1.5 inches. Of course, there's,
okay.
Right. Like sometimes it's vastly different when it's erect. So yeah, it's not always, back to your original question, it's not always due to pleasuring the partner. And I think even if it was mostly due to that, guys will want it to look normal, right? It's an important part of people.
Like self-image, yeah. I understand.
Right.
What about, some people, some people is curved, some people straight. Does that make the procedure more difficult? Or, if someone has an unusual shape, again, does it present more challenges?
I mean, there's always challenges, right? If anything is, obviously doing things when it's straight is the easiest. There's certainly challenges if someone has abnormal anatomy or difficult anatomy, but it doesn't make anything impossible. It just makes it kind of harder to get a perfect result, but it's doable. And again, when we're talking about curves, there's normal curves and then there's pathologic curves. Like you can Peyronie's, which is curve that's pathologic. It's usually due to scar tissue formation, sometimes after like having a penile fracture, or you could just have a natural curve that's just
interesting. So is the person sedated fully or just like light sedation, or is it localized anesthesia? Like what is the procedure itself like? How long does it take? The recovery, that kind of thing.
Yeah, so that's a good question. There's no sedation at all. I've never had to give anyone sedation. It's a fully injectable procedure, so it's pretty much just pure local anesthesia. So what happens is, we do a regular history and physical, like we're all doctors, and make sure there's no medical contraindications to having the procedure, do a physical exam, make sure everyone's on the same page. Like, that's where we have a discussion about what your goals are and what we can do and what to expect. Some paperwork filled out and all that. And then when it's time to get started, we just clean the area with alcohol and chlorhexidine, which is a regular surgical scrub. The area is marked with a pen, like a sterile marking pen, to basically we'll mark where the anatomy is that we want to stay away from, and also mark where we want to put the filler. Then the skin's numbed with lidocaine. That's really the only uncomfortable part.
Yeah, it's probably like a pinch, and it's obviously a very sensitive area. No man wants to be.
There's lots of parts of your body that are sensitive, like your fingers are really sensitive, for example, and so are your toes. So like local anesthesia hurts a lot there as well. I'm not sure that the area, so we're not talking about injecting the head, we're talking about injecting the shaft usually. And generally speaking, that area is not like nearly as sensitive as the head. So those are really not that bad. As your listeners, or I should say, I'm sure a lot of your listeners have had local anesthesia at the dentist, for example, or maybe on the skin, and it's not much different than that. So yeah, it stings for a few seconds, and after that, the area actually numbs quite well, and it's extremely rare that anyone feels anything after that. After that point, it's done with needles and a micro cannula. So a cannula is basically, think of a needle, but the tip is not sharp. The tip is still very small, like the same diameter or circumference as a needle, but it's like it won't poke through something. So that's what a cannula is. And so we use that to inject the filler. And the reason we use that is because since it's not sharp per se, it doesn't tend to poke through like skin and blood vessels and nerves and all that, like kind of things move to the side instead of getting poked through. So that's one of the ways that makes it safe. So in any event, we use that to inject the filler. It can take anywhere from 30 minutes to an hour to, do it carefully and make sure you get the filler in the right place and the right layer of in the right tissue plane or layer. After it's just wrapped up in a gauze basically, and we give everyone our contact information, and then that's it. Virtually 100% of the time, people leave way more comfortable than when they came in, right? Because when they come they're nervous, they don't know what to expect. Almost 100% of the time, they'll literally tell us, "Oh, that was way less invasive than I thought it was going to be."
Well, that's good. What about follow-up? Like, what do people report the feeling of an erection? Like, what's an erection like to experience after this versus before? What is intercourse like after versus before? Have you gotten feedback from people?
Yeah, sure. So most of the time, the feedback is good. Like I said, probably 95% of the time, it's good feedback. Partners usually partners are happy with the bigger size. And even when I started doing this, and some people would get small amounts and I wouldn't notice a huge difference, but we still found that partners actually did notice because the area that is going is quite sensitive. So a small increase in size can actually have a big effect on the partner, even though me as the doctor might not notice it.
All right.
So it's usually good feedback there. One of the concerns people have beforehand is we're injecting filler and it's going in as a gel, and they're concerned about what's going to feel like, right? Is it going to be soft? Is it going to be hard? Or, where is it on that spectrum? And as you might know, there's various types of filler available that have properties that are different in firmness and in duration. So we try to find a filler that has a firmness that is close to an erect penis and that is as long lasting as possible.
What do you mean long lasting? What happens over time? If someone has the procedure 6 months ago, does the penis slowly revert back to its former dimensions over time? What happens?
Yeah, so it depends what kind of filler you use. There's different types of dermal filler available on the market. And all of these fillers, by the way, are usually marketed and approved for use in the face. So the fillers I'll talk about here are the same ones that you might get in your cheeks or your lips or, various other wrinkles in your face. So we use hyaluronic acid filler, which is the most modern filler and probably the safest. Hyaluronic acid is found in your body naturally. It's the matrix that your cells are in, but because it's found naturally in your body has an enzyme called hyaluronidase that your body produces that naturally breaks down the hyaluronic acid over time, and then your body replaces it. So kind of one of the things that makes hyaluronic acid filler safe is that because it's natural to your body, you have a low chance of things like allergic reactions and one complication that we don't like to see called granulomas, which is a foreign body reaction. That it's an immune reaction to a foreign body that your immune system produces. So that's the most modern filler, and it's the one that we typically use. Your body can break it down due to that enzyme, and the enzyme's actually available to purchase commercially. So if there were to be a complication or something needed to be fixed or changed, we can actually use that enzyme to dissolve the filler, and that's another thing that makes it particularly safe. But there's other kinds of fillers available. Okay, so going back to hyaluronic acid, the one we use tends to last 18 to 24 months. They're not permanent because, like I said, your body breaks them down. There's other fillers available, though, with varying degrees of longevity. Another popular one is called Radius, which is calcium hydroxyapatite-based filler. It lasts a little bit longer. It's made of calcium, so your calcium's eventually dissolved when it's in fluid or blood or whatever, but your body doesn't really have like a mechanism specifically for breaking it down. So that one tends to last a little bit longer. The downside being that it can't be dissolved intentionally. There's filler called PMMA, which is polymethyl macrylate, which lasts like several years longer, but that has basically no ability to be removed unless it's surgical. And then there's a filler called Belafil, which also lasts about 5 years, but again, typically needs surgery to remove it if there were a complication. And there's like older fillers like made of collagen, and those are like like bovine collagen and stuff like that, which are not used anymore. Yeah, there's some fringe things like silicone can be injected, but that's not really a dermal filler.
Yeah. Well, it sounds like this one's practical. You know, someone could change their mind. So I guess over 18 to 24 months, you know, the person reverts back to their original dimensions. Is that what happens slowly?
Yeah, like it is variable. People have different levels of hyaluronidase that they naturally produce, like just based on your genetics. So some people break it down longer, and then, you know, it'll be gone in 12 months. And I've seen people that have had it for more than 3 years. The other thing is your body's breaking it down, but it's not like, let's say I'm giving an example that it lasts on average 18 months to 2 years. It's not like entirely gone at that point. It's just usually at that point where they notice that it's not really as much there anymore. So, you know, since it's not all gone, for people that still want to have it, still have the filler, they usually come back and they don't need to get as much as they originally got.
And I guess some people could say, hey, doc, you know, I don't want it anymore. Can you use the enzyme and dissolve it? You could do that too, right?
Yeah, totally. I can think of offhand 2 patients I've ever had that have wanted it dissolved.
Why?
One was kind of a funny story where the guy had broken up with his boyfriend and went on like a social media dating site, and then met someone, and that person like talked to him, and he decided to kind of impulsively come in and get this filler done. And then he broke up with that guy and then got back together with the original boyfriend, and the boyfriend didn't like it. And so he came in and had it dissolved, and he was actually totally happy with it and not even thrilled about getting it dissolved. But it was just like that circumstance that made him, you know,
Right. I understand.
Convince him that was the thing to do. So there's that, right? And that's a perfect example, although an extremely rare example. That's why you could get something that's dissolvable put in it, right? And then I have another guy that showed purely just that his wife, for whatever reason, didn't like it, and he came in and I dissolved it. But, you know, I've probably done 600, 700 procedures at this point, and I can think of 2.
Yeah, that's pretty good. You talked about couples saying, you know, it's more pleasurable, they're happy with that. But again, when someone gets an erection after they've had the filler, does the erection feel different? Do they feel like pressure? Does it, you know, again, does it feel different from, you know, beforehand?
Yeah, like I think obviously it's a material we're putting in there that is not your natural penis tissue. So it is going to feel some amount different. I would use the analogy of breast implants, right? They're designed to feel, to the extent humanly possible, like real breasts, but they just don't. And so this is the same, right? We're putting in a material that has different characteristics and properties than normal penile tissue. It's close, but people do notice occasionally that it feels different. And, you know, you yourself are pretty, not you specifically as an individual, but people in general are fairly in tune with how parts of their body feel, especially their penis. So like marginal small differences can be noticeable. But I would say objectively, from the perspective of the guy that is doing the procedure and then seeing people on follow-up, it's not a lot different.
Okay. Is there a similar procedure for women? For some reason, if they want to enlarge or make engorged appearing, you know, their outer extremity, their outer genitalia, like Botox, you know, for down there. Do women ever do this?
They could, like the labia, embryonically, the labia is equivalent to that engorges too, right? Yeah. So I'm trying to think of a way to describe it. well, but essentially you have the same tissue planes in the labia that you have in the penis. Okay, so like we have the tissue planes is skin and then a fascial layer called dartos fascia, and then an area that has basically, you know, some blood vessels and fat and basically what we call a potential space. So an area of nothingness for the most part. And then you have a layer called buccal fascia, and then you have the functional part of the penis called the corpus cavernosum, and the urethra is there, and all kinds of other important anatomical things. So in the labia, you actually have the same first few layers. You have skin, and then dartos fascia, and then buccal fascia. Now the injection that we do is either in the skin or in between those two fascial layers. So you could equally put it in the labia the same way that you put it in the penis. As people age, their soft tissue becomes more kind of saggy, kind of. So I think as women age, their labia become less pronounced, maybe is the right word. So they could get it done. I'm not aware of anyone that does it, but I've kind of heard of that being a possibility. And certainly from an anatomical or medical perspective, it is a possibility.
Okay, gotcha. So for people listening that, you know, are interested in contacting you, do you just have one clinic, or do you have clinics all over the U.S.? Like, how would they avail themselves of this?
Yeah, we have clinics in many different U.S. cities. I think we're at 13 or 14 clinics now. So odds are wherever you are, there's one within a reasonable distance of you. We actually also have one in Canada that just opened, and one in Panama City. Listeners can go to our website, which is upsizematters.com. And if you go to the website, there's a doctor finder page where you can kind of select your city, and it'll give you the clinic that's in your city. For people that are in California, particularly Sacramento and the Bay Area, that's where, and so I work out of the Bay Area, Sacramento, and Miami. So people that are in those two areas could actually come see me. Otherwise, it's other doctors that we've trained how to do the procedure, and many of our doctors have done hundreds of procedures.
Okay, well, very good. Well, excellent. Well, thanks to Dr. Pash for coming on the call. It's, again, a usual subject, but, you know, it doesn't seem to cause harm, and it seems like a thing that people want, so I guess why not?
Not only does it not cause harm, but it's extremely low rate of complications and extremely high satisfaction rate. Well, thanks for having me on the show. I appreciate it.
Yeah, and if only every procedure were like that, so I guess it's a good thing, yeah. But yeah, thanks again for coming. I really appreciate it.
Okay. Have a nice day. Nice talking to you.
If you like this podcast, please click the link in the description to subscribe and review us on iTunes.
You've been listening to the Finding Genius podcast with Richard Jacobs. If you like what you hear, be sure to review and subscribe to the Finding Genius podcast on iTunes or wherever you listen to podcasts. And want to be smarter than everybody else? Become a premium member at findinggeniuspodcast.com. This podcast is for information only. No advice of any kind is being given. Any action you take or don't take as a result of listening is your sole responsibility. Consult professionals when advice is needed.